So those are kind of some common things that you can expect if you've had a cesarean birth, but most women actually don't know that those are common things to expect.
Hey parents, parents-to-be, or curious individuals. Chelsea here from Mabel's Labels headquarters. I had the honor of sitting down with the amazing Dr. Sinead Dufour. She's a pelvic health physiotherapist, professor at McMaster University, director of pelvic health, as well as running her own full-time practice out of the womb located in Burlington, Ontario. And on top of all that, she's a mom of twins who she herself has had an elective cesarean birth. So it's safe to say she really knows her stuff when it comes to C-sections. She shares her insight on what to expect, recovery, when you can exercise again, what is safe when it comes to exercise, and most importantly, how pelvic health physiotherapy can help moms who've had cesarean births. Before we dig in, if you want to be a part of our parenting community where we continually strive to put out encouraging and helpful content for parents of all types, subscribe to our channel and make sure you turn on that little bell notification so you don't miss out on a thing. Now I'm going to let Dr. Sinead Dufour take it away.
Hi everybody. So my name's Sinead Dufour and I'm a professor at McMaster, and then I'm also the director of pelvic health here at The World of My Baby. And I'm going to be talking a little bit about cesarean birth. And actually at the womb we don't use the term cesarean section, we use the term cesarean birth. And some of the questions that were often asked about cesarean birth, one revolves around what should women really expect, because women have this notion of there's a comparison between a vaginal birth and then a cesarean birth. And many people have ideas about what these two different births will look like. And yes, there definitely are differences, but at the end of the day, we can't really compare all vaginal births in one basket and kind of are the same and have the same recovery, and all cesarean births being that way. What we've actually started to see, with the clients we work with and with the research that we do, is that really what tends to dictate how a woman recovers relates more to the trauma of the birth, whether it be vaginal or a cesarean birth. And there definitely are differences, especially where the pelvic floor is concerned, and of course I am a pelvic floor physiotherapist, in terms of if there was an elective cesarean birth versus if there was a cesarean birth that actually had to go through after the woman had labored for an extended period of time. These different situations have different impacts on the body. So certainly a woman who's had a cesarean birth but no trial of labor first, what she might expect is really not the same degrees of actual trauma to the direct pelvic floor, but she might expect the usual things we see with abdominal surgery, which actually creates a lot of tension through the pelvic structures, including the pelvic floor. So oftentimes women who have had a cesarean birth still can have trouble with something called urinary incontinence, where you're leaking urine if you cough, laugh, or sneeze. And that's ultimately because the structures are too tight, there's too much tension, they can't work properly. And that's where someone like myself, a pelvic physiotherapist, could really help to reestablish the correct length and fitness in those tissues. The other thing that can happen because of this abdominal surgery is, and again it's because of this tension, is painful intercourse. And this is something many women aren't expecting because they think, well, my vagina should be okay, I didn't birth a baby through there, what on earth is happening with this being so painful? And again, it relates to all this tension through that area. And really for us to correct the tension, there's lots of work we actually need to do on the scar where the incision was made for the cesarean birth. And there's lots we can do as pelvic physios. Our collaborators here at the womb, like our osteopaths, do a beautiful job in helping us to release that tissue so that can all function properly again. So those are kind of some common things that you can expect if you've had a cesarean birth, but most women actually don't know that those are common things to expect, right? So a next piece that we're always asked is, well, if we've had a cesarean birth, what does that mean for us working out again? How do we exercise again after? Does that mean, the rules are different for us because we have now had this surgical procedure done? And in ways, yes, and in ways, no. So again, depending on what the birth looked like, and you could have a vaginal birth that actually ended up being pretty traumatic, that instrumentation or surgical procedures were used, either with forceps or an episiotomy, and that has implications for resuming exercise and healing, right? But you can also have an elective cesarean birth, actually feel really good about it and heal up quite quickly and actually feel like you're ready to start exercising a lot earlier. So in the end, it sort of does depend on your unique situation. But some common things that do occur when there has been a cesarean birth, again, when we talk about this tension and that tightness around the scar tissue, because of that, engaging in traditional abdominal exercises after, an individual with that scarring and tension is going to be more likely to not be able to execute traditional ab work correctly. And so what ends up happening is the tissue in the abdominal wall ends up being more likely to get damaged and distorted, because essentially load has to kind of transmit through that tissue if you're doing an exercise like a crunch, for example. And if the tissue at the bottom of the pelvis is so tight, the force actually jumps over that and almost explodes right above it. So we see often that women who have had a cesarean birth are much more likely to end up with a diastasis, and that's sort of what women think of as an abdominal separation. It isn't really that. It's more the tissue in the abdominal wall is distorted, so the superficial muscles look separated. But this is something that can happen. So certainly we want to make sure that women who have had a cesarean birth, that they understand about this tension, that we are helping them to really make sure that scar tissue is taken care of, that their pelvic floor and all their structures are working really well, so they're able to execute these types of exercises properly. And so in many instances, it's difficult to do this if you don't have guidance, from ideally a pelvic health physiotherapist, because that's someone who actually can go inside the pelvis and really make sure that you know how to properly redevelop the fitness inside your pelvis. But then sometimes it's really helpful to work with other individuals to really take care of the tissue outside the pelvis. And some of this work actually women can do on their own in terms of releasing their scar tissue, but they need guidance. And unfortunately, in our usual care system, these are discussions that just aren't being had with women.
Pelvic health physiotherapy is absolutely incredible. I can say based on my own firsthand experience, it's pretty life-changing. If you have any questions about pelvic health physiotherapy, you can contact the Womb. They're located out of both Milton and Burlington, Ontario, but they're happy to connect you with any resources and information. We'd love to hear from you, so please give us a like and let us know in the comments below if you've ever heard of pelvic health physiotherapy before, or if this is an entirely new concept to you. And if you have any questions, and we'll do our best to get back to you. Thank you for watching.